Now, last week I must have received about 1,000 emails, seriously, from viewers with questions to our expert. It kind of told me that you're hungry for information and explanation about COVID-19. So joining me now in Canberra via Skype is a former advisor to the World Health Organisation, Professor of Microbiology at the ANU, Mr Collignon. Professor, thank you very much for your time.
Thanks for having me.
Can I ask a question based on my first interview this evening with someone in Seoul, South Korea? If we had enough masks right at the very beginning of this, and we had enough for hospital purposes as well, and we could, refill from our own manufacturing plant, would you have, if you were in charge of this virus, would you have recommended that all Australians wear masks?
Well, at this stage, we actually have been quite successful at controlling this infection in Australia, the same as Korea has been. Not only have we flattened the curve, the daily cases of a new disease is actually going down, both in Australia and New South Wales. So the epidemic curve has more than been flattened. We've been successful so far, just like Korea has. Now, how much a role masks play in that is still controversial. What has made a difference was closing our borders, closing our clubs, bars, places where a lot of people get together inside, quarantining returned travellers, and closely following up all the close contacts, and making sure they're quarantined as well, and limiting, mass gatherings. And also, I think what everybody is doing is the social distancing, keeping 2 metres apart, both in the shopping centres and everywhere else. That has made a huge difference. We are now in the situation where we look like we've turned the curve on the first wave, and we should congratulate ourselves that we've got the lowest mortality in the world, one of the highest testing rates, and we look like at this stage it's coming under a sort of control, but we've got a long way to go.
OK, Ian writes to you, can the virus survive in seawater?
I don't think we can answer that. We do know that the virus can be found in sewage, for instance. It is excreted in the bowel. How viable that virus is still not clear. Just because on testing we find what they call the RNA or the genetic material of the virus doesn't mean that it's all that infectious. In the overall scheme of things, we still believe that most of the spread, 95, 99%, is from person to person rather than anything such as through water. But we just have to keep an open mind because that has happened before with SARS, for instance, in Hong Kong. But the predominant way this is spread is person to person, because otherwise we'd be seeing a much wider outbreak than what we've seen so far, both overseas but in Australia, because it's still contacts that are 95% of the cases we find.
OK, David, in washing your hands, is using hot water more effective than cold?
Well, that may depend how well the soap lathers. I mean, what's most important is, in fact, washing it physically down the drain, and then how well the soap can lather, get all over your fingers, the back of your hands, because that actually, and detergent, probably kill the virus in part because it's got a fatty or lipid coat, and anything that disrupts lipids seems to help kill the virus.
Right. Stephen asks, mosquitoes, can they carry and transmit the virus?
Very, very unlikely, and I'd say no. Mosquitoes do carry disease and cause disease, but in every case, the actual virus or the bug like malaria multiplies in the mosquito. So basically, this virus does not multiply in insects and mosquitoes as far as I'm aware, and nobody's said anything different. So for mosquitoes and flies, I think the answer is no. OK,
David's got a good question. Just wondering how bad the normal flu season will be this year, given it's going to be a bit hard for it to get here, as there will be no flights and no cruise ships coming to Australia for the next 6 months. Does that play a role?
Well, it does play a role, although flu seems to hang around all the time, including in summer. It's just in very low numbers. What happens for every respiratory virus, they all multiply in winter. Something to do with the temperature, something to do with people probably being closer together, something to do in places that have got lower humidity and heating. We don't know why, but what we do know, it happens. And this is a respiratory virus, and it's probably why it's so bad in London, New York. It's been going there for 2 months unrecognised, unlike Australia where it wasn't. But we still need to be bright about this. Korea is in winter and they managed to control it. But that's why what we're doing now is not going to finish anytime soon. That's why people repeatedly saying we've got to do this till September, and it may be for another 18 months to 2 years.
All right. Why, asks Len, are the recovered numbers so low? There seems to be a long delay in those numbers. Or we're not focusing, I don't see the health department focusing on the recovered numbers at all.
Well, I think it's when you call it recovered, they're looking for both that you're back to reasonable normality and also we're sure you're not, transmitting the virus or having the virus. And that's one of the problems. You can find the virus around by testing. Whether it's still alive or not is an argument. But people who are really sick, for instance, most people have something that's not worse than a cold or a flu-like illness. They're sick for 4 or 5 days and they get better. But people who are very sick, it may take, for instance, up to 10 days to get sick enough to be in hospital, and then you might spend another 10 days in intensive care. So the people, the 20% who get quite sick with this, they don't have a 6-day illness. They might have a 1 month illness before we can say that you're recovered or not.
OK. John asks, can the bug linger in a chlorinated swimming pool or shower recess?
Well, a chlorinated swimming pool, chlorine is very good at killing this virus. It's one of the better antiseptics. So one would presume that if the chlorine level is adequate, and the pH and the pool is being looked after, then this virus, even if it's in low numbers, should be killed relatively quickly by the chlorine in the pool.
OK. Andrew says, my question is, as a fit and healthy middle-aged man, would it be beneficial for those of us who are in this bracket to be infected with the coronavirus, quarantine for 14 days, so then we have an immunity to it?
Well, that's called the herd immunity theory. And the problem with that is, yes, for most people, they'll get it and they'll get over it and they won't be sick all that long. But the trouble is if you have huge amounts of people infected, this virus, from my take, has about a 5 to 10 times higher mortality rate for all age groups than does influenza. Influenza is actually less than 0.1% in the community. I think the mortality rate of this will be about 0.3, 0.4%. It's actually relatively low so far in Australia.
Yep.
So, you say, oh, that's not bad. But even a mortality rate of 0.1% and you say you're 40, you think, oh, that's pretty good. But that actually means if 100,000 people get infected, 100 people will die. So I think at the moment, the most sensible approach is to limit the spread as best we can without all becoming hermits, without all becoming locked down, doing things that are reasonable. My own view is what's happened in New South Wales and Victoria is unreasonable, this extra lockdown they've done, stopping people walking in parks, etc. How are you going to catch that if you're more than 2 metres away from everybody else?
And
that aside...
And while you're still on that angle, though, is it not healthy to be in the sun and improve your immunity?
Well, I think it is. I mean, there is no doubt. I'm not aware of any transmission outside in small groups of people when they've been in sunshine or outside, and particularly if they've kept distances from each other. I'm not aware. All the outbreaks we've had in New South Wales have been indoor events or predominantly indoor events.
OK, Paul...
So
sorry, go on.
It's healthy to be outside.
Yeah. OK, Paul is a healthcare worker. Can the COVID-19 virus be contracted by skin-hand contact, even after washing and sanitising hands?
Well, we think a lot of it is through our hands. People cough or sneeze or have it in their nose or their mouth. It gets on surfaces. We touch it with our hands, then touch our own nails or mouth or eyes, and we get it in that way. Nobody can say there's no virus around, on anywhere, even after you've washed your hands or your skin. But the virus would be very low numbers. And some of the evidence also suggests, and it's intuitively sensible, if you get only a low dose of virus to infect you, you've got a much better chance of recovering than if you get a high dose of virus. Right. So while that's theoretically possible, in the total schema of things, it's minor for all the infections we've identified so far. OK.
Inga, what rate of COVID-19 infection is required to achieve herd immunity? When is this likely to be achieved? Will a stronger shutdown simply delay the turning point?
Well, I think a lot stronger shutdown at this stage when our cases are going down and we're on the appropriate side of the epidemic curve. I can't see what it's going to achieve. But having said that, herd immunity for measles or something like that usually means 80 or 90% have got protection. And I actually don't think that's going to be a very good idea to achieve by just letting the infection go rampant. That's what's happened in the US, in New York and London, and I don't think a good idea.
No.
We might get enough immunity, like to have 70, 80%, when we have a vaccine that's both safe and has efficacy. In other words, it works. But realistically, that's 18 months, even 2 years away. And you can't even be sure we're going to get a vaccine. Look at HIV, look at Hep C. They've tried for years to get vaccines for that and didn't succeed. I think we will get a vaccine, but we can't pin all our hopes on it to happen very soon.
That's a very good point. I saw, one last one, I saw a hospital recommendation sheet that was pinned up in an ICU, and it recommended that those healthcare workers take Listerine to keep the mouth clean. Would Listerine, alcohol Listerine, help?
Well, I'm not sure what the concentration of alcohol in Listerine is. The only problem is you don't want it in your mouth in the first place. So the more important place to stop it is at your hands with alcohol hand rubs or soap and water, so you don't have to worry about the Listerine in your mouth.
You've been very helpful this evening. I've been really encouraged by the clear thinking and common sense that you've written about in several areas over the past 2 weeks. Thank you very much for your time.